Hi, my name is Dr. Marwan Sheikh. I'm a reproductive endocrinologist in Jacksonville, Florida. We'll be talking today about fertility after tubal ligation. We do see a lot of patients who've had 2, 3 children and they either get married or they had their tubes tied when they were young and they changed their mind. And the question they have or the options they have are, do I untie my tubes or do I do in vitro fertilization? So, in a nutshell, in vitro fertilization, just to summarize, is basically stimulating the ovaries to produce eggs, taking the eggs out, which is a simple procedure done in the office, fertilizing the eggs in the lab, and transferring the fertilized eggs, which will become embryos, either 3 or 5 days later into the uterus. We transfer one embryo and freeze the extra ones. As opposed to in vitro fertilization, tubal reversal is surgery. So the patient will have to go under general anesthesia in an operating room. It takes about 2 to 2.5 hours, and she will be in recovery for about an hour, and then she goes home. The recovery is at least 2 weeks after the surgery. And it can be done in different ways. The most common way, which I use, would be microsurgery using what's called mini laparotomy. So we make a small, tiny incision about 4 inches above the pubic bone area. We go into the uterus and fix the tubes. The other options would be either to do it by laparoscopy or robotically. Using the robot makes the procedure much more expensive, and the results are not necessarily better. One of the issues that help us determine, does the patient do IVF or does the patient do tubal reversal, is the hormone, measuring the hormone anti-Mullerian hormone. As you will see in this slide, a follicle is the sac of fluid that has the egg in the ovary. The cells around that egg produce that hormone, which is called anti-Mullerian hormone. So the more anti-Mullerian hormone you have, the more eggs you have in your ovary. The less anti-Mullerian hormone, the less eggs. And normally we go with the level of 0.6 or 0.7 nanograms per ml. So if you have less than 0.6 nanograms per ml, you have a very decreased ovarian function, and in that case, it would be preferable to do in vitro fertilization. And the normal levels are usually between 0.7 and 3.5. The other thing that we look at is the antral follicle count, and that is, again, the follicle is the sac of fluid that has the egg. Like in this ultrasound, you'll see this patient had only 2 antral follicles. That's a decreased ovarian function. Again, in these patients, it would be preferable to do IVF than in vitro fertilization. While in this patient that has 10 antral follicles, she would be better off doing in vitro fertilization. You get more eggs, probably better chance of pregnancy. What about the success rate of tubal reversal? It depends on several factors. One is the tubal length, and this is a tube. So if the length of the tube left after tubal ligation is 4 centimeters or more, that would be good. The longer the tube, the better the chance is. And the place or the area where the tubes are tied is important, because if it is tied in this area close to the uterus, you have the best chance of pregnancy. And if it's tied closer to where the end of the tube is, these are the projections from the tube that help pick the egg from the ovary. If these are damaged, and the closer you are to them, the less the chance of pregnancy. The time of sterilization really is not important in itself, but of course, if a patient had her tubes tied 10 years ago, she will be older. So that is what really going to determine the chance of pregnancy. How about the type of sterilization? The best type of sterilization would be using the clip or the ring. If the tubes have been burnt, or unfortunately recently a lot of doctors are removing the tubes completely, of course the chance is better with in vitro fertilization. The age of the patient is important. The younger the patient and the more regular her cycles are, the better it is as far as tubal reversal is concerned. One of the things you worry about tubal reversal is the higher chance of ectopic pregnancy. That's a pregnancy in the tube. And the chance would be about 5% in these patients to end up with an ectopic pregnancy. In general, the chance of pregnancy in the normal population is about 1 to 2% ectopic, so that increases it to about 5%. And finally, we go with the acronym AGE, and AGE stands, A is for anti-Mullerian hormone, so we look at that as we mentioned before. G is for Guy, for checking the sperm, make sure that the sperm is normal, because if it is low or not in a good shape, you may be better off with IVF. And E is for the egg. For example, if a patient has problem with ovulating and after you untie her tubes, she has to be on hormones to make her ovulate, she may be better off with in vitro fertilization. Thank you very, very much for listening.